Yeah, Jessica, really the big discussion was how our medical leaders here have been addressing the pandemic and the steps that they've taken to ensure the spread of COVID-19 stops here. The U.S. Surgeon General made plans to come here on Friday. He says that efforts across the country have been paying off.
The reason I came here was, number one, to help everyone understand what's going right. And what's going right is that we have significantly lowered the death rate from this virus.
United States Surgeon General Jerome Adams paying a visit to Kern County, meeting with medical leaders, county supervisors, business owners, and education figureheads. One of the purposes.
I also wanted to give the folks here hope, because I know that there's a lot of fatigue. I know it feels like this has been going on for forever, but honestly, we are, I think, over the hump. I think we're over the hump because our positivity rates are coming down. I think we're over the hump because we're near a vaccine.
Adams toured alternative care sites at the county fairgrounds and also got an inside look at Kern Medical Center's trauma center and COVID unit. He says he also spoke to businesses who were frustrated because of current restrictions in the state.
Several business owners brought up their concerns about the need to get businesses open, and I shared those concerns with them. And I said the quickest way to get businesses open is to drive down community transmission rates.
Here in the county, those community transmission rates have been improving significantly since July. That's when we saw the most positive cases since the pandemic began. The last reported case rate in the county was 6.8 per 100,000 residents, which is under the state's threshold of 7 per 100,000. Meeting that metric allows several sectors, such as restaurants, gyms, and houses of worship, to partially reopen inside. But that's where the frustration lies.
The state has now artificially adjusted our case rate so that they are inflating our case rate because we are testing at lower than the state average.
And again, our case rate is 6.8 per 100,000 residents here in Kern County, and the state's threshold again is 7. The state says that they had to implement this new methodology to make sure that there are adequate testing happening here in Kern County so that we have a better snapshot at exactly what the case rate is. According to the Kern County Public Health Director, Matt Constantine, he says the state added 1.4 percentage points because the county isn't meeting the average tests that we are seeing in the state. And this is exactly what they're going to discuss tomorrow at the Kern County Board of Supervisors meeting at 9 a.m. They're going to try to figure out creative ways to get more people at home to go get tested, and this isn't just once. Matt Constantine says they're looking to get people to test multiple times. For now, we're in East Bakersfield. Bayan Wang, 23 ABC, connecting you.